visit, okay? Well, I asked Dr. Mark, can I come to class so that he could demonstrate a neuro exam? Because I have what to neurologists are, you're fine, but I have a lot of subclinical symptoms. And I do have a diagnosis and potentially second diagnosis. So I thought, well, this would be a good case to see how a physician goes about doing a neuro exam, an interview to find out. My chief complaint is that I'm weak and I feel like crap all the time, and I have visual problems.
Anybody here? For my assistant? Harry. Oh.
What?
Oh, you just got
I
in.
was just repositioning myself.
Oh, geez.
Wait, do you test the nerves?
Yeah. Go ahead and test the cranial nerves.
I'm scared.
What is good? She's okay.
Do you have a flashlight? Somebody probably has one on their
For
keychain.
the dilation?
Yeah, yeah.
I might have it in the office.
Okay, so if he's going to go get the flashlight, let's kind of do this how you would do 1, 2, 3. You all know the cranial nerves? You think? Right?
3, 4, and 6 are eyes.
Yeah.
One is smell.
Okay.
Called
So what's one?
olfactory?
Olfactory is smell.
Okay, so how would you doctor check that?
Smell something.
Yeah, lots of times they ask, you know.
Let's put the other on in the morning.
Okay.
And then we just turn away.
I'm actually hypersensitive to smell. Whether that's a cranial nerve problem is another story. All right, what's 2?
Optic.
Okay, here. Okay, so how might that get checked?
Light.
No, not yet. This is 3, 4, and 6.
Oh yeah. Well, it's vision. Just
How many
vision.
fingers?
Yeah.
2 is optic.
Yeah. 2's optic. 3 is oculomotor.
That's it.
Okay. So, optics. So if Mark asked me how many fingers, I'm going to say 2. At least that's what I thought you hauled off.
7.
But, right, okay.
Remember the movie?
But, let me try to, like, stand here. Okay.
Trochlear, then trigeminal.
I can see all of those big letters, okay, albeit they're blurry. I can see none of the things underneath the letters. None of them from here. So come over here. Can you read any of the, under the CU, what's under it?
Where?
The CU, where's CU?
Copper,
What do you read?
29?
What are you
63.546.
reading?
Okay, so
The
she's
numbers on the
reading
bottom.
the numbers under it,
On the
Here
wall.
you are.
and I can't see any of those
What they-
numbers under it. Oh, you're good.
You're so
Okay.
Is that normal for you?
But yet, huh?
Is that normal for you?
Yeah, and this is my chief complaint too. I just was at Emory Low Vision Clinic, and you know, I can get the answer right if you give me enough time, or if I can walk right up to it, I can see from here 63.546. But notice she could see it from there, right? But I can't. So there are, you know, limits. Am I legally blind with glasses? No. So I didn't have any place in the low vision clinic. Do I have to be up on a sign before I see it? Absolutely. So what do people do to compensate for that? Well, the glasses don't work. No.
making things larger.
Well, I can't make what's in my environment larger.
Just wait until you get there.
What you have
I wait till I get there, right?
Mm-hmm.
So what do old people do?
Slow down
They
at every
drive
corner.
slower. So you don't want to be driving behind me. Okay? I drive a blue minivan. You don't want to be behind me if I don't know where I'm going. If I know where I'm going, I'm fine. At night, forget about it. I can't
And that's
even
why I
drive.
was late this morning. I was behind you.
Yeah, right. That's his excuse, right? So it's kind of a soft problem. You know what I mean? Like on the eye chart in the room, I'll get all the answers right. but I'll kind of like say, well, that might be a B or a C or, and eventually I get it right. So the doctors will say, well, corrected, she's okay. Because they're not measuring my response delay time. Does that make sense? Okay. So that would be optic, right? Is basically visual acuity. Okay, so oculomotor. Come on, assistant. Come over here and do it.
What would that be? What would? Yeah.
Okay? So do
Yes.
this so I can look at the black
Black.
thing. And you might want this.
You want to stay?
Get down on your knees so the camera can see it. Okay? And what you want to do, okay? Tell me what to do.
Follow the
Come on, be here.
follow the black top. And you're done. Then you go to this side.
Okay?
Then
So,
go this way.
okay, so I do not track to the left.
Right.
So don't try to pass me over there on the road, okay? Over here I track, okay? What other direction should we go in?
Up, not so good. Down. You can go down. So no
Okay.
left and no up.
No left, no up, okay? All right.
Now, but was it in both eyes or one eye?
I only can see this
Okay,
one.
so, all right, so do each eye independently now.
Okay, follow the top. A little bit. Up. Down. You
Okay.
squinted more going down.
Yeah, okay, try this eye.
Nope. Up. Up. Squint. Down once more.
It's not really, if you guys want to come up in the back, you're welcome to. It's not really a squint. It's more like a fluttering is what it
Fluttering.
feels like to me. It's not a nystagmus, but it's like I can't get there, so I got to do something different. I don't know.
You were like, it was like
Yeah,
closing.
okay. Is there anything else you notice about my physical appearance?
One eye droops a little more on the side.
Oh,
Yes, very good observation, okay?
The left.
Now,
Okay.
all of us may have one eye that is smaller than the other. But this is another nerve we're dealing with, right? That opens and closes your eyes. What nerve is that?
Vestibulocochlear?
Not
No.
vestibulocochlear.
No, that's your ears.
Mhm.
There were three nerves.
Okay.
Three nerves that innervate
Three, four, and six.
abducens,
Six.
six.
Yeah.
Okay, that's this.
This is, and three was oculomotor. Oculomotor
Right.
innervates
Trochlea.
and trochlear.
Trochlear.
Cranial
Well,
nerve
that's
four.
this, moving your eyes up and into the back of your
You
head.
did good that time.
Yeah, but
But
I
you weren't
lifted my
following
head
it.
back. That's
Yeah.
the only way I can do it.
Yeah.
Okay? Because I have a prosthetic in my eye. Okay, so I can't voluntarily. Right now, I think that I am opening my eyes really wide. But I'm not, am I?
No.
Okay? I am maybe raising my eyebrows, but my eyelids aren't opening. Okay? So the nerve that innervates the eyelid opening is not working well. Okay? Now, so I had a procedure twice, had revisions twice, where they put slings in your eyelids, and so if I go like this and move my head back, I can open my eyes, but that's the only way I can do it. So I'm probably due for a revision on this left eye, and get it done every couple of years, and they just pull the sling up a little more. The problem is if they pull it up so much, you won't be able to close your eyes. So I have to sleep at night with ointment in my eyes and one of those eye masks on because my eyes don't close. So then you treat a problem, you create another problem. Okay, so we got 3. What about 4? Was what?
Trochlear.
Okay, so can I move my eyes, roll them back up into my head? What happens when I do that? I get that fluttering
And
stuff.
they start to close.
So I can do it, but again, it's sort of like, that's what I mean about subclinical. Some neurologists or physicians would say, oh, she can do it. It's a little funky, but she can do it.
Mm-hmm.
So, okay, what's the next cranial nerve?
Or
5.
Five.
Trigeminal. So how would you check that nerve?
Blow on your face or
Okay, it's more of a sensory, right? So what would you do?
touch.
Can you feel it? Yeah, I can feeling. Albeit, and again, I don't even know if this is related. There are some days I wake up and this whole side of my face is kind of numb and tingly. Now, it doesn't hurt, it's just numb and tingly. Additionally, sometimes I wake up in the morning and these 3 fingers in both hands are numb and tingly. Doesn't hurt, just numb and tingly.
Both hands or just one hand?
Both hands.
Your face was only one side though?
Yes.
So which nerves?
Okay.
Median and face?
Trigeminal. Yeah.
Maybe, or what's that
But it's
other
only
one?
one facial nerve.
7, maybe, right? It depends on where it is, right?
Because if it's numbness, mostly we're talking about muscular, not sensory, on the face.
Right.
Sometimes you feel on the face like it's not a numbness in your face, but on the skin. So you feel like the skin is like tightening, and that would be another fine. But if it's tingling and you start feeling muscular, contraction like.
One thing I do notice, come, you be the model. Go like this and hold it, okay? And so, you know what I mean? Like she's not real weak at it. Do it again, hold it. Don't let me push it in. Okay, now you do me. It's a little weaker. Like I have much less ability to hold it, So there is some weakness in the facial muscles too. And I notice I keep joking to my husband a couple years ago. I said, I look like Arlen Specter. And you may not know who he is. He's a politician, was. And like he really had jowls going down like this. And I was like, God, and my husband's blonde. He looks so much younger than me. It's no fair. And, I was like, God, I look old. And like, so I try to smile a lot so people know I'm not grumpy. You know what I'm saying? Because when your face droops, it makes you look like you're in a bad mood. Does that make sense to you all? So you kind of have to consciously. So for me to smile, look at her smile. It's like a lot of effort for me to smile. Okay? Okay, so what do you got? 5, 6 we did, which is abducens. Okay? 7, we talked about the facial nerve.
Which one? The next one is 8. Which one is that?
Okay, so how would you check that?
First of all, do you need to check now?
No, because you're following directions.
She hears you. She follows the directions.
Okay, so we know the hearing part's there,
Right,
but
now,
what
what
about
about
the
balance?
vestibular part?
Balance.
One leg.
First of all, she got the proper, proper gait. She just walked in, okay, without cane, without walking. That's one thing, okay. So you are part there.
Right,
Part.
right, yeah. I will say in the OT and PT world, if a patient reports a history of 1 or more falls in a year, that is a cause for a problem. You know what I mean?
But this is a fall without a reason.
Yeah.
Not tripping over something.
Right, just a fall, and I have lots of falls, okay? Now, I have a lot of postural sway when I try to of course I correct, but if you're testing me and I go like this, I lose my balance before, tell me your name?
Carrie.
Okay, Carrie would. Is it C or K? K-E-R-I.
A-R.
Pronounce the same way.
K-A-R-I, I say that, Carrie.
Yeah.
Okay, so Carrie, do this, okay? And she's not going to lose as quickly as I am, or my amplitude of my loss of balance is bigger. Does that make sense? So I have to do a bigger, but again, a neurologist would grade this fine. So it's sort of this subclinical problems. I'm dizzy a lot.
You can get them from students.
I get more dizzy with extreme visual stimulation, like walking into Walmart, okay? Walking out of a store and walking into a store. I'll let me grab your arm. Let me grab your arm to my husband or my kids. Okay? So that may not be vestibular. It may be that visually it's like so overwhelming that it makes me dizzy because I can't focus my eyes. I don't know. Okay. Did somebody want to check my eyes to see if I can dilate or not?
Do you need to take off your glasses?
Yeah, and I might have to do this. Let me cover one eye.
Hang on.
Okay, wait. I want to get closer.
It did.
Okay.
You want me to get closer and do it again?
Well, wait. You got to wait.
It's a strong.
All right.
Is it? Can you see you?
I don't know. I can't
Can
see
you see
anything.
it?
I'm
Yep.
blind.
Yep.
Yep. You can see it.
Okay. Interestingly, it doesn't always do it. It's kind of not consistent. Sometimes I dilate, sometimes I don't.
Also, one more time.
Mm-hmm.
Do it. Shine it in the right eye, but watch the left.
Yeah. This is
Shine
the
it in the-
consensual reflex.
Consensual reflex.
Is it on?
I didn't see anything.
Okay.
Do it the other
Now
way.
do the left.
Do the left and watch the right.
It did dilate some.
Yeah.
Okay.
Oh. What cranial nerve is that with dilation?
Pardon?
What cranial nerve does dilation?
Good question.
What about Becky's question?
We didn't cover it yet. We didn't
Chapter
cover it.
17 or something.
We're gonna be talking about it.
Okay.
Special senses.
So one of the ones for the consensual reflex, like what you do to one eye, the other one responds, doesn't work. I knew it was one that didn't work. Okay?
The left one.
Yeah. All
The
right.
left one
So you did vestibulocochlear. What's 9?
Which side?
Mm-hmm.
Glossopharyngeal. So you do tongue stuff and swallow stuff, right? Yeah, we get it. Yeah. Yeah, use abbreviations when in doubt. Okay, so 10 is. Oh, okay. Well, let's do glossopharyngeal. Pharyngeal. How would you check it?
Tongue.
Oh, okay.
Yeah, struggling.
Again, and I'm sort of exaggerating, but it's slightly effortful is the way I would describe it. Like if I eat rice, I need to do a lot of extra swallows for rice, which is why I typically don't eat rice. I'll be good in a nursing home because I can eat like grits and oatmeal, refried beans, and they just like slide down your throat. You know?
Soft.
Yeah, that's me. So it really does depend on what food I eat, but again, you know, it would pass the test, but I'd call it like just, you know, patient reports effortful swallowing is how I would describe it. Or you could just say patient is crazy. I mean, you know. Okay, I have a condition unrelated to the thing you're supposed to find out. Well, it might be related. Called sympathetic dysautonomia. Sympathetic dysautonomia. Which may or may not relate to the vagus nerve. Yes. I take something called Mitodrine, or Proamatine is the trade name. And this is a recent event, okay? I told my husband, this was like last April, and I said to him, he travels Monday through Friday, and I said, he was ready to go away on Sunday. I said, honey, I just don't feel right. I think I have diabetes. I'm just like sweating and just like feel like I'm gonna pass out and just no energy. And I said, well, why don't you just take me to the urgent care? Well, he took me to the urgent care. My pulse rate was in the 40s. And it stayed in the 40s for like 2 or 3 hours. And then they said, well, you could go home. You just have low blood pressure. I was like, this is it? You're sending me home? I mean, I don't think a pulse rate in the 40s is normal. Okay. So then I did go to a cardiologist, and he did something called a tilt test, which they give you medicine to elicit a response that, oh, I was horrible. Anyway, I did, and he was like, oh, okay, you have sympathetic dysautonomia. I was like, okay, thanks. So he put me on the medicine. It has help. I'm supposed to take it 3 times a day. Typically, sorry, Doc, I only take it once a day. Lots of times I'll take the 2nd dose, but rarely do I take the 3rd dose. Because I kind of like him doing okay without it. So, and it's kept my pulse rate in the 60s, and that's pretty good for me. Blood pressure has always been low my whole life, kind of, pretty much my whole life, 110/70. So, even though the heart rate was low, the blood pressures were still okay. So my blood pressure was kind of compensating for the reduced pulse rate. Okay, 11. Accessory. Okay, so you want to check what, Becky? Okay, so traps. Okay. Can I elevate? So go ahead, do a muscle test, Carrie.
Would depression be in it?
Well,
Elevation.
depression isn't
Something
really
else.
accessory, is
What
it?
is it?
Is an elevation?
Yeah. What
Okay.
is depression though?
Depression is
Or try to lift.
yes.
Because you want to see, against the pressure. Yeah.
Okay.
Say hold. I always say hold it and don't let me push down.
Okay. Hold. Don't let me push. You're good.
Okay. What's going on from the front that you're all seeing?
Straining.
Okay. If you don't look at the patient from all angles, you know what I mean? She didn't see the overflow. You sit, and now I'll do it to you. Okay. Hold it up. Hold it up. Don't let me push it down. Okay. Now you do me. Just so you could see the difference. Do it to me.
From the back.
I don't care.
Okay. Hold.
Okay.
You do it in the front, from the front.
Look at her from the
So
front.
I
Yeah.
can see it.
Yeah.
Yeah.
Okay. Shoulders up real quick.
Uh-huh.
Hold.
Okay. So you're seeing all this associated stuff. Again, do I pass the neurologist test? Absolutely. The other thing that happens is, and I don't know why when I'm driving a car more so, but it tends to happen more at the end of the day, and now I'm not going to be able to elicit it. Let me see if I can, if I just kind of sit for a minute. And I look like Katharine Hepburn. Bogey, right? Okay? This is how I look, and I'll be driving the car, and the kids are saying, Mom, are you saying yes or no to us? And I'm like, no. And I can just sort of adjust my head and get it back to normal. Okay? So right now, I'm having to use a little muscle strain. If I just let it go, I can... I don't know. It's up to you to decide. You're the doctor.
Yeah.
I did get treated. I noticed it, and again, I'm a bit of a hypochondriac, but so again, I went back to Emory Neuromuscular Clinic. Okay, now I'm having a head tremor, which isn't part of this eye thing supposedly. Well, let me send you to the clinic, just evaluate you for Parkinson's. They do the neuro exam, make me walk. You don't have Parkinson's. See ya.
And what
So.
do you have?
I don't have Parkinson's. Thanks. I didn't think I had Parkinson's. Okay? I have, as far as the quality of my vision, the other issue is, I said it's the acuity, but I have halo images or ghost images. So I don't quite see double, but I see like a shadow image of Timothy in the back of the room there. So his head, I see a little, kind of like, what I feel like? And then I feel like there's like spots in my visual field. So I'm cleaning my glasses a lot, thinking that my glasses are just dirty. And I kind of feel like Monet. If you look at Monet's painting as he was losing vision over time, that's the way my world is becoming. Okay? Yes. No. Oh, does fibromyalgia affect the eyes?
Mm-mm.
Okay. Yeah, that's a good question.
Some more training.
Well, it's funny you should bring this up because when I was originally, okay, if I might give you a little background. In 1994, I went for glamour shots. And this is important, glamour shots, get your picture taken. And my one eye was droopy, and I was like, you got to redo this picture because it's your fault. And so I made them redo the glamour shot, and the left eye was still droopy. That same Thanksgiving, I saw my brother, who I hadn't seen in a while. He said to me, what's wrong with your eye? And I was like, I don't know, nothing. And so didn't do anything about it. I just said, I'm doing a lot of computer work, tired, blah, blah, blah. And I saw a GP for a physical who happened to have been a physical therapist. And this was in 96. And she said, has anybody ever checked out that droopy eye of yours? And I was like, oh, I didn't think it was that bad, And so she said, I think you should go see a neurologist. And he did a test to me. And I'll tell you what the test was, and then you could backtrack and tell me what diagnosis I don't have. The test is called a Tensilon test. I think it's Tensilon. I didn't have that diagnosis, so he said, I want you to go for an MRI then. Well, right before the MRI, I found out I was pregnant with my third child. So I never followed up because I was like, I don't want her to get radiation for something that isn't keeping me this dysfunctional. Do you know what I'm saying? Mm-hmm. So then I didn't follow up on it, and was having all these weird allergies, just crazy behavior, hypersensitive to smell, wacky. My mother-in-law had moved in with me at the same time, so perhaps, there was some connection there. Anyway, so my husband just looked at me and said, you're just friggin' crazy. Okay? He didn't say it that way. He's much more of a gentleman than that. But anyway, so I went to a psychologist, and this psychologist was like, I think you have thyroid problems. And I got diagnosed with a thyroid problem. I don't know if there's any connection here to the droopy eye or not. Anyway, all with these weird allergies, I went to an ENT. And he said, has anybody ever checked out that eye thing? I don't like it. So I go and, he said, why don't you go to an ophthalmologist? And so the ophthalmologist then was like, well, I can't do anything about it, but guess where I can send you to get something done about it? Emory. So I go to Emory, and they work me up. They do a muscle biopsy. They do an EMG. And an ENG. Okay? ENG, neurogram? I don't know, neurography. They basically check your peripheral nerves to see if they respond when they give you shocks, and I'm screaming the whole time, that hurts. And then they do muscle testing, like a surface EMG. The nerve test was both the muscle and the nerve tests were a little, they called them subclinical, and so they said, we want to bring you in for a biopsy. So I got a muscle biopsy, which confirmed red ragged fibers. Okay? And so then they said, oh, you got this diagnosis, there's no treatment for it. And, just get an EKG every year. But they still can fix your eye sling. They can fix that, but they can't cure it, okay? So of course I'm searching online over and over what can be done. I feel like crap all the time. I have no energy. And this is me with no energy. Can you imagine me with energy, right? I was really a productive person 5 years ago. Anyway, so I start looking online. This is recent. And I say, I just want somebody who can prescribe supplements that'll boost my energy. Okay?
What is, not to interrupt you, but what is red ragged fibers?
I'm not telling you. That's for me to know. You to find out. Okay?
Thanks.
You'll find out if you start searching on the internet real quickly. Yeah. Perhaps. But I don't have it. Anyway, so I find this doctor. I'm not going to tell you what kind of doctor, but she did do some genetic testing. And I just now, after the testing was done in October, and I got an email 2 weeks ago saying you have 4 factors for this condition. 4 of the secondary genetic markers for this condition, which wasn't the condition I was originally diagnosed with. So again, I don't know, do I have both factors, both diagnoses? Is there 5 diagnoses going on here? 1 that all relates to each other?
Now, when did you start having this ptosis in your eye?
I would say 94. Yeah, so it's a while.
It's a while. Is it the same ptosis now, or it got worse or better?
Oh, much worse. And it
So it's progressing.
continues, definitely progressing.
Quite important to know.
Yes. Okay, you ask questions so they can see a master at work.
I still want them to. I want to have a lot of assistance.
Did anything change like throughout your practices with the different hormones? Did you have any different symptoms that you say was related?
No, but you know, I only have one. Well, I have one child in '96 and one in '98.
Does any of your kids or family from
I didn't answer the question.
Did
So
they have any of these?
when the doctor at Emory was working me up for all this, I was like, you know, it's kind of interesting when I look at pictures of my dad. In his Navy pictures, he had big brown eyes, and I looked just like him. So adorable. But anyway, and then like by the time he was like 70, we would joke and say, Dad, you look Asian. Like his eyes were so thin. I don't mean to be politically incorrect. I'm sorry. But I know, and so write me up, okay? But I'm sorry, Tim. You're gonna write me up? Okay. And his eyes are bigger than mine. But there you go. So, but they tell me that the first thing I was diagnosed with could not have been passed down by my dad. So go figure. But I am having the same physical dysfunction that he had, but nobody believes me. You know what I mean? It's like it can't be from your dad. And I will tell you, I am having the falls, the numbness in the hands, and the eye thing. This is the way he used to drive.
Oh, wow. Is
Why
it
did
And he would
his
say,
vision was
my
down
eye
here?
shades, I have to lift my eye shades, man. And we'd be like scared to death driving.
Why did they say it can't be from your dad?
I'm not telling you. For me to know and you to find out.
Oh, wow.
Developmental conditions.
What about the females in the family?
Oh, there are 8 siblings, 9 kids. Nobody else has problems
No one.
neuromuscularly that we know of. One sister at one point was diagnosed with MS, but I'm not so sure.
How old was she when she was diagnosed?
20, 30 something. She and another brother have a blood disorder called von Willebrand. Well, a lot of us have a factor for von Willebrand's disorder. But I supposedly, when I was tested for von Willebrand's, did not have the genetic marker for it. Go figure.
What about your hearing?
Huh?
We haven't done
we
the last.
What's
cranial
the 12th?
Hypoglossal.
Oh, we didn't do hypoglossal?
Oh, you can.
Normal.
That's my alarm for me to take
That's
my
a-
supplements.
That's your tongue.
Yeah,
Normal.
normal.
Had you, or did she stop and
She
you
did
drank
the.
water and-
No, she did this.
Oh, okay, I didn't see that.
Could go ha.
Yeah.
Pretty good?
Yeah.
That was not wrong.
I think it's okay.
Did you have your hearing tested?
Yes.
I know you can hear, but
When I went to the ENT, and it was was okay, even though I complained to him that I can't hear. But he felt that it was allergy sinus related. And I'll tell you, since I dealt with the thyroid stuff, I take Armor Thyro, which is a little bit more of a natural supplement kind of to get your existing thyroid function to work. All those allergy things pretty much went away. Pretty good.
With
With
what?
that medication?
Yeah. Once I was on that 6 months to a year,
What was it?
all my sinusy stuff got a lot better. I also take Singulair every night. That's the only 3 medicines that I take. And a whole bunch of supplements.
You said you could see spots. Is that just floaters or?
It's really weird and it's not consistent. So like right now when I'm looking particularly further away, so looking at Becky and Tim in the back of the room and Jimmy, Michelle, it's almost like there's just little dots in my visual field.
And it impairs your vision.
Yeah, but they almost seem like they're clear, so I want to go, oh, they must be on my glasses, like they're raindrops on my glasses, but they're not. Well, the only thing that's painful is the inside of this eye, the left eye. Every morning when I wake up, it feels like something's inside the eyelid. And I have to kind of like open it and close it a few times to get it to...
Could that be that conjunctivitis, the stuff that you can get in your eyelids?
I would think I would have other symptoms of it. Like, redness and inflammation, but I don't. It's actually painful. Yes, I have that done every year, and every year I go to the ophthalmologist. Your prescription's fine, your eyes are fine, you don't have cataracts, you don't have glaucoma. I just went to a retinal specialist at Emory, and she's like, your retinas are fine. Maybe. Yeah. Uh-huh. But they're annoying. So, why do I have to live with this? Okay.
Do you get migraines or like any kind of headaches?
Never had a migraine in my life. Thank God. Because can you imagine me with that? I'd really be complaining.
I wonder if it's something.
Blood work. I wish I had brought it with me. I have like a notebook this thick of all my medical stuff. Recently my vitamin D was really off.
What about magnesium?
Was off. Calcium was off. What is it? Did you all read chapter 2 or with the action potential thing?
Oh yeah.
Yeah.
Okay.
It seems like because it's mostly one side of the face over the other, it almost seems like a weird, strange version of Bell's palsy in a way.
But does Bell's palsy? What does Bell's palsy involve?
Paralysis of the
Of
face.
what?
Of the facial.
Facial
One nerve.
No.
How many nerves are involved?
A bunch.
You know what I mean?
Well, like some of the symptoms are similar to it.
Right,
especially
right.
With the all
Yeah.
in the face.
Yeah.
You
You're right.
know,
So,
partially.
it may be more than just cranial nerves is my point, right? Go ahead, Becky.
Your signs and symptoms seem to match up with Guillain-Barré.
Do they?
What does it?
Decreased sensation and motor paralysis. Cranial nerves, if affected, may cause difficulty in chewing, swallowing, speaking, or facial expression, even deep aching pain or hypersensitivity to touch.
I'm not hypersensitive to touch.
So I mean, it's a good differential.
It's a good,
Consider,
yeah.
but rule that.
Well, and Guillain-Barré usually starts like a flu-like thing,
That's a good idea then.
and this was not,
Consider
there
this.
wasn't a precipitating thing.
So when you say that your magnesium was off, I presume it was low.
I don't remember.
Did you have a parathyroid check?
Yes, and I believe it was problematic too.
Lactic?
I don't know. Yeah.
Uh,
I know pyruvate was a problem.
CPK?
CPK was okay.
CPK was okay.
Yeah.
Did you ever have spinal tap?
I have never had a spinal tap. Why would he ask that question?
For meningitis.
Some kind of infection? Why else would they do a spinal tap?
See if there's enough fluid or not enough.
Well, you
Or
check,
fluid
you
problems.
check the pressure, yes.
Yeah.
But I wouldn't do it just for that.
Yeah.
The chemical makeup of the spinal fluid can impact conductivity of the nerves and stuff.
Okay.
Yeah.
There's a diagnosis that's made based on that lots
Is
of
it the
times.
meningitis?
Well,
or something?
yeah, but not an acute condition, a more chronic condition.
It's not spinal.
Begins with M, not meningitis. Told you my sister had it. Yeah.
Yeah.
Okay. So sometimes they will draw fluid there, and they're looking for something in particular, IgG, right, or in your fluid, but they never have done
How
that.
come? Why not?
I don't know because I guess I don't meet all the requirements for that. But I do, and when I look online, I'm like, I have some of those MSE kinds of things. And MS is hard to diagnose, because it doesn't present the same in all kinds of people. So you
then-
guys decide,
So
among
also
yourself.
said that you have to, you were supposed to have the MRI when you were pregnant with your
Oh,
first
and
child.
I had an MRI in the past year. I've had several, and they were all normal.
Normal.
Normal. In fact, I went to the MRI, to the neurologist this year, and I said, can you do it a little lower down? Because I'm thinking my cranial nerves. Each year I teach neuro, and each year when I go over the cranial nerve exam, my cranial nerves are a little more and more diminished. They're not absent, but they're kind of decreased. So she did. And she did a lower MRI all the way through the neck, and it was all normal. And she said, your case is beyond the scope of a regular neurologist. Why don't you go see, Yes.
Wow.
But it's an OT test. OT would be what we're looking into.
Well, hopefully you might know some other specialists, you know what I mean, that I should be seeing. No, ma'am. Good question, though. No seizure disorder, no history of seizures.
Do you have headaches?
No headaches, no migraines, other than, like maybe an occasional sinus headache. Like when I wake up with that numbness tingling thing, like all here, I'm like, oh, is it my sinuses? Or do I just need coffee? And that doesn't always help it.
Do you still feel weakness and energy?
Yes, ma'am. And I actually like exercising, but the ability to initiate the task is just, once I'm doing it, I'm usually okay. I can sustain it, like a walk or a little bit of run, walk kind of stuff. Swimming, but to start is just like too overwhelming for me. And again, I go to the doctors, and they're like, could you be depressed? And I'm like, do I look depressed to you? I just am not a depressed person,
So you think is it a psychological aspect, or you're just too tired to initiate?
I want to blame it on my muscles and not my mind, but it's both, I'm sure. But I can't open jars. I can't sometimes open soda cans. I mean, like little stuff that I should be able to
It's
do.
not MS?
I ask my kids to do. Oh, the gas cap is the worst. Okay?
Yeah.
And when it's cold out, it takes me sometimes minutes to open my gas cap at a gas station. And I occasionally will have to ask somebody to do it for me. When I eventually get it myself, it's like two hands, and it's like, ugh, like I'm opening, I don't know.
Does your dad have MS?
No.
And what about grasping the leaves? How's that? Like,
Okay, like a normal grip is for an adult my age is about 40 pounds. Mine is about 20 on a good day.
Finger. Oh, you're good. I mean, it wasn't strong, but it wasn't super weak.
Yeah, it's subclinical. 20 pounds is not a normal grip for someone my age. Again, your neurologist says, oh, it's fine.
It wasn't that bad, though.
It's 20 pounds when it's supposed to be 40. That's not normal for a 50-year-old,
It's
okay?
about right here. Let's see if I can pull it open. I can pull it open. Yeah.
Yes, miss, in the back.
I was going to ask, have you been having any disruption of memory or emotion?
Forget.
Well, let me tell you this, okay? And sometimes this is the way people figure out that you have a problem because they can't find the problem. So I go to this doctor and I said, I want you to put me on a bunch of supplements that fix my problem, or at least make it not so bad. So I take about 30 supplements a day. He's probably freaking out over there. A big cup of them in the morning that I have to sit down and like
The idea to open the store.
takes me a big effort to take. I notice when I don't take them that I feel like all circuits are not connecting, but not a memory problem, more of a processing problem. Like I'll say, what did you say? Okay, and like my logic and my sequence and my thinking is not as quick or sharp. Again, it's subclinical. If you gave me a mini mental status exam, I'd do fine on it. Okay? What else?
So far, very good questions.
Have you noticed if you're awake? I don't want to know, obviously, but have you noticed any difference? Weight gain or loss, either which way on the spectrum?
Okay. I have been overweight my whole life. In June 2009, I had a procedure called the gastric sleeve procedure and lost like 65 pounds, and pretty much I've kept it off. So I don't know if my symptoms have gotten worse since then or not. You know, I've noticed I'm starting to gain a little weight, so I got to start really watching what I eat because I'm probably stretching my stomach a little.
Do you do any alternative outside of just the supplements? Do you do
I get massages.
chiropractor?
I meditate. No, I don't do chiropractors. I mean, not
What
that I'm
about
against it.
acupuncture?
No, but I've considered it.
Has your sleep pattern changed?
Sleep. Good question. Sleep. I would say, see, now I don't know if this is part of normal aging, you know what I mean? In the past 10 years, my sleep has gotten worse and worse.
What do you mean?
Like I wake up easier, I don't sleep as soundly. It's not getting to sleep, I'm fine, because I'm usually exhausted by the time I get to sleep. But staying to sleep, and I wake up early pretty much every morning, but it's like the quality of my sleep might be less. Yes, ma'am.
Do you often find, you said you get fatigued and things, do you often find yourself, is it hard to reach overhead, climb the stairs, or rise from a chair? Doing any of those things? Do you find any difficulty?
What about a lower chair?
Reach overhead, go from a stair, from there. No, I can move furniture, but I can't open a jar. I can't lift furniture because I have no grip strength. But like if you wanted me to move your couch, I could push my body against it or push it this way and I could move your couch. So I think big muscles are better than small muscles. That would be my assessment, but
Are your symptoms worse at night or a particular time of day?
I would say more like, when I'm fatigued. Oh, the other new symptom is that in order to read, I have to take my glasses off and read this close to the paper in order to read. I usually kind of like do close one eye and read with one. And it doesn't matter, I can do either eye. So like my Kindle at night is here.
Is it worse also when you're under stress?
Maybe a little, but I can't figure out a pattern. You know what I mean?
How does your body handle stress? Like when you're under a lot of stress
I
with work
scream.
or whatever.
Scream at my kids, my family. Ah! Like that, you know. And then I'm over it and I say, I love you. And, you know. Yes. Are you looking stuff up online? I love it.
Because you said that you never had any seizures.
No, ma'am.
The red rag fibers
Mm-hmm.
is really commonly associated with the syndrome of nerve, but it says one of the main symptoms is seizures, but you have some of the other symptoms.
What's the disease?
I guess it would be MERRF. It's
Yeah.
called myoclonic epilepsy. With
Yeah.
red rag fibers.
I ain't got that. But good try.
Michelle.
What is it? I love the internet. It's great, isn't it?
ASS. So this will be.
What did you say, Jessica?
If it's myochondrial, that's why it can't be from your father.
Okay, so
Okay.
one of two things could be happen. I'm wrong, and it isn't from my father. So you want to believe me, or you know what I mean? It is from my father, and they don't know about this condition. It could be that, right? I don't know. KSS is a close thing to what I have, but nobody's ever told me I had KSS. Cairns-Sayre syndrome is what it's called.
Did you have a normal CBC?
Normal CBC. So all of the inflammatory things, like for arthritic or autoimmune disease, all of those markers were normal.
Which markers?
Some of my
weren't?
vitamins and electrolytes and those kind of things were out of whack, though.
What about go way back? What do you remember being told anything about like when you were born? If there's anything strange? That's what happened to me. All my stuff like happened from
I
when
was
born.
beautiful, exceptionally beautiful. No,
Except the parents wanted the boy.
yeah, right. Hey, they didn't care at that point. I was number 5. They're like, whatever. No, I was probably one of the healthiest kids, except that, you know, we all bring our baggage with us. My mother used to say, you're lazy. You're lazy. You better marry a rich man, because you're lazy. So instead, I married a husband who does housework. Yay!
So
Got
did
you, mama.
So
But
did the muscle weakness?
anyway, so, you know what I mean? And I think I may have had like exercise-induced asthma. Like if I ran around the block, I'd come home wheezing. But nothing that ever got treated. And I was always much more well than all of my siblings.
So did the muscle weakness maybe start at an earlier age, just not diagnosed?
That's what I think she's trying to get at. I don't know.
Or it could be like I was just thinking strange, weird, crazy things like something that would affect a child. If you were exceptionally healthy, never got really sick or anything, you get a childhood disease when you're an adult, and it's completely different. And
Right.
A lot of times people don't think about that. So.
I don't know. I don't know. Is there anything else that you would ask?
No. The only thing I would be curious also about your height. Is everybody the same height in your family?
They're all short people. All short. Dad
I do
is
want to say short.
on a
That's
good
why I said
day.
that.
Well, it takes one to know one. Dad is Dad was 5'7" on a good day. Mom was like 5'1" on a good day. All my brothers and sisters are short. Annie is the tallest one, and she's 5'4". She is like a giant in our family.
How tall are you?
I'm 5'7"
Five-
and a half in the morning, 5'7" in the evening.
Yeah. I am 5'1" and a half on a good day. You know, probably 5.
Is that have you lost height?
I don't think any more than normal aging. You know, get gravity's effect on me.
Yeah.
I do have the only other appointment I've had. So all the genetic testing is not in. So the doctor told me, well, these 4 markers that I'm not telling you what they were don't necessarily mean blank, okay? I'm waiting for the rest of the genetic test to come in. So I'm like, okay, and how long is that going to take, you know? This was October that I was tested. That's good.
So are you on
Can we rule out KSS?
MELAS.
What?
MELAS.
The-
MELAS. It's a mitochondrial myopathy that has lactic acidosis, stroke-like episodes, and other features like seizures, diabetes, hearing loss, cardiac short stature, exercise intolerance, and neurophysiatric dysfunction.
Well, the dysautonomia would be a neurophysiatric dysfunction, but I don't have the seizures,
Yeah.
right?
Those are other
And I
features.
don't have stroke-like episodes, unless you would call intermittent numbness. But I don't really have intermittent motor paralysis. You know what I mean? So I don't know if you would count that.
Michelle, you looking up for KSS?
Have you always had the weakness in your hands? Or did that just start recently?
No, because of course I'm a therapist.
Yeah.
So when I was that's why I know when we were doing grip strain testing in OT
You saw it
school.
decrease.
Yeah, and I've seen it gradually. It's 50% of what it was when I was 20, and that's not normal.
One thing we know, it's chronic. It's not, you know.
Yes,
so
and that I'm
starting
a
with that.
functional human being, right? It's annoying. It's an inconvenience. Am I going to die from this? Probably not. But the most recent genetic thing scares me because you do go blind from it. So, you know, but she said, don't be all upset because we don't know if you really have it. In other words, you could have a genetic marker for something but not have the condition. Does that make sense?
Mm-hmm.
Now, so of course I'm worried if I have the genetic marker about my children. It's too late. I've already had them.
But that gets carried. Yeah.
Yeah.
I found another one, progressive external
Mm.
ophthalmoplegia.
Mm.
That's mitochondrial.
What is it? What is it
It
called?
would all make
It's PEO, progressive external
Ophthalmoplegia.
Chronic.
Chronic. So most people call it CPEO. Chronic. We meet that criteria. Progressive.
Yeah.
External ophthalmoplegia.
Yes.
Okay.
Hard one to say.
Yes. That
Is that
and I
it?
tell them that
Sounds
that
right.
is my
This is
first
it.
diagnosis. Yay.
Good.
But chronic, progressive, external, meaning the eye muscles that go outward, ophthalmoplegia. Right? The eye muscles that go outward are not working well.
But wait, okay, you said
But-
that was your first diagnosis.
Yes,
so
this
you don't think
second
that's
one-
what it is.
Well, I
But
don't
you
know.
don't know.
What was the genetic marker for that?
Oh.
Oh.
No. That's what the tensilon test was for. The tensilon test was for myasthenia gravis and it was negative. But you're right, eyelid droop is common with myasthenia gravis.
Is what?
They're related.
Yeah, they're cousins, but I don't understand. I don't get the genetics.
I saw that up there.
I just put it on.
It was up earlier. Or there was the other parts.
Okay, let me
Well,
tell.
how can you, how can you rule out the KSS?
Yeah, what's,
seizure portion.
well, what's the other criteria?
Mental retardation.
But basically, side we didn't check.
Oh, she doesn't have hearing loss.
But look at the other one.
She may have some.
Seizures,
She may have some.
some, but not-
You know why? Because notice that, I mean, here she's teaching, okay? So she's talking so the Tim can hear her in the back.
Right.
But the question is, does she normally talk in this voice? Because if she talks so loud, that means she has some, most likely, some slight hearing loss.
Well, my
Because people-
father was 90% deaf. My father was 90% deaf in one ear and 80 in the other.
But she doesn't have the seizure. See, I was checking. I was asking about the short stature. Okay. Well, we didn't take delay. We didn't talk about this delay puberty.
No, mine was early onset.
And various endocrine disorders. Normally it was, it was normal. So it's kind of like.
Right.
Just because somebody has maybe hyper or hypothyroidism doesn't mean he has KSS.
Right,
that doesn't
yeah.
mean- Okay.
And the onset wasn't before age 20 either.
Right.
And the pigmentary retinopathy doesn't exist. So that's why they would rule out that condition. Does
Right.
that make sense?
Right. And the key right here is
Yes. So since Brianne figured it out, so we'll wrap up the story in a nice package. So I went to this geneticist because I was like, I feel like crap all the time. And apparently dysautonomia can be associated with CPEO. But I was like, there's got to be something that can be done for this condition. So I was like, mito cocktails. And a mito cocktail is a bunch of supplements that they put together for people with mitochondrial disorder. I got online and started looking up mito cocktails because I was like, well, I want a doctor to prescribe me this mito cocktail. I don't want to play with supplements myself. So I found this person who's a mitochondrial specialist and a geneticist together in Atlanta, conveniently so. She's internationally known. And so I walked in her office. She said, I want to work you up for other genetic possibilities. Okay? In the meantime, here's the prescription for the mito cocktail. The mito cocktail has helped. Again, am I normal? No. But it certainly has helped on some level. But so the first round of genetic testing that has come back has given me the 4 secondary markers for LHON. Leber's, LEBERS, hereditary optic neuropathy. So my question is it like, does one condition cause the other? Did I really have Leber's all along? And they misdiagnosed it as, the other thing? I don't know. Or do I have both together?
There's a possibility.
Yeah.
And what's so different about the mitochondrial DNA? All comes from mother.
Yeah.
And it's not helical, but it's
But
circular.
mom didn't have any.
And
But your
has-
sisters.
It's circular, not
They
not
don't have the
helical.
problem.
Yeah, your sisters don't have the problem.
Doesn't have 24.
But the brothers could have it too if it came from the mother.
Yeah.
But it didn't. I mean, they all said, all the doctors are like, you're barking up the wrong tree thinking this is from your father. I was like,
Oh.
well, he looks like me. I have the same exact symptoms,
It does
same
say-
exact progression. What's going on here?
It says some individuals with HON, usually women, may also develop multiple sclerosis like illness.
Yes.
Multiple sclerosis is like.
Like.
It'd be
Not
the
Right.
key
multiple
word.
sclerosis.
Multiple
Multiple
sclerosis,
sclerosis is like.
Yeah.
That's a key.
Postural tremor.
So that could be the head tremor.
Peripheral neuropathy.
That could be the numbness, tingling.
Non-specific myopathy and movement disorders.
Yeah. I mean, this makes more sense to me than does the CPEO, but I could have both. Who knows? They're both mitochondrial conditions, right? So go figure. All I could say is at least it's a chronic thing.
It says it develops during young adult life, though.
Yes, but some people can, develop it later. I'm going to see. So when I walked out of the low vision clinic about a month ago with them saying you're normal, I walked upstairs to the neuro-ophthalmology clinics and said, can I refer myself to a neuro-ophthalmologist? Because I'm not being dealt with correctly here. And it turns out that the neuro-ophthalmologist at Emory, that's her specialty, one of her specialties. So again, there's no treatment except CoQ10, and that's what I take almost 1,000 milligrams a day. You guys probably would take 100 milligrams a day. Okay, I take massive doses of it to try to feel relatively normal. You know, so I don't know what she'll say when I go see her. I'll go see her in March. Nancy Newman. So we'll see. The geneticist was called, what was her name? I liked her. Yeah, she's a mitochondrial person. Oh, that was Dr. Yan, who I saw in retinopathy. Yeah.
Another question.
Good job, guys.
Very good, because it's so rare. In the
Yeah.
United States, it's very rare.
I was looking up mitochondrial disorder and it's the gene link.
See, I wanted to give I want to give them, extra points for somebody who discovered it, but,